Yes, so let me just check, am I audible? Is the screen clear? We can start the session now. Okay, so this is the conceptual understanding of anatomical terms. Basically, this is very important session for the first year MBBS students, and also those who are going to enter in the first year MBBS students, and actually because of them only they have asked me to take this session, so I am going to take this live. Okay, so please let me know, am I audible? Is the screen clear, so that we can start the session? Okay. So yes. Okay, so yes, everything is audible and we can start the session now. So conceptual understanding of anatomical terms, as this session will be more of anatomical terms used for the description of bone, which I will highlight today because that was the concern of few students. So myself, Dr.Monalisa, have done my MD Anatomy from Armed Force Medical College, Pune, and I have got a total of teaching experience of 9 years. And let's talk about the special class features. When I am talking about special class feature, it's an interactive session where the learners and educator can interact. Polls are conducted among the learners. They can participate in poll and they can ask their doubts right itself when the session is going on. Raise your hands and get your doubts clear. Never ever miss this session. So my dear aspirants, when you start seeing the session on the special platform also and you start following that educator, you will get the notification regarding all the session taken by the educators. Once the session is finished, you can also download the PDF notes. Anytime, anywhere, read from the top educators of Unacademy platform. So these are the benefits of joining the special free session and it will be highly beneficial for you. Use this code ANAT10 and get an additional discount of 10%. And also can be used for getting and get an unlock code for the free session. Now, All India mock test is ready for you, my dear aspirants. So, mark on your calendar, it's on 19 Feb at 9 am. So, 19 Feb 9 am. So, do enroll in this All India mock test. Get ready for this. This is especially on the free platform. Use this code ANAT10. So, use the code ANAT10 to get enrolled in this free test. Okay, anatomy quiz which is going to happen on 6 p.m. and the conceptual and which have already been taken by me, those who have missed out they can see, and that was followed by a open house session strategies to study, and today also conceptual understanding of anatomical terms, and I will take a it will be followed by 15 minutes of open house discussion where I will tell you why it is very important to understand anatomical terms if you are going to start your study with the basics of anatomy. So yes. So this will be the open house session will be started once the session of my YouTube session is just finished. This will be correctly started. Now, let's talk about the plus subscription where all 19 subjects are completed in a very systematic way. You can access both live and recorded version. You can study from India's top educator, compete in live test and quizzes, study on the device of your choice, assess more than 25,000 MCQs, and coming soon, you will be provided with the printed notes of Unacademy. So, these are the benefits which can be availed by you. Let's talk about iconic subscription. So, when I am talking about iconic subscription, you get the benefits of the Unacademy and also you get the benefits of the prep ladder. This is highly beneficial for you. So, you can grab this opportunity and you can be the part of clinical integrated essentials, video lectures from Dream Team, QBank 3, rapid revision, snapshots and dream notes of the prep ladder. All these benefits can be availed by you. So, actually this means you can have an access to two important best platforms for cracking your entrance examination. Use the code ANAT10 for an additional discount of 10%. Now, I would also like to congratulate the toppers of FMG December session 2021. So, I wish them best of luck. I am very glad to share their images and I also wish them best of luck so that they can target or crack their NEET PG exam in the first attempt. Now, let's talk about NEET PG subscription, whether it is plus or iconic. So, when I am talking about NEET PG subscription plus and iconic, I mean to tell that all 19 subjects can be targeted by you by taking the subscription, and for both of this subscription, this is the pricing detail, a comparison can be made and you can get an additional discount of 10% by using the code ANAT10. Now, I would also like to tell you about the updates of highly effective QBank where more than 25,000 MCQs can be targeted. Clinical MCQs based on latest pattern includes a detailed explanation for each and every MCQs, and for assessing 10% discount you can use my code ANAT10. So, these are the benefits. This will provide you an extra discount. So, go for it. I would also like start the session, and after that we will have an open session discussion. So all those students who are live, they can, in the app, though they have to download the Unacademy app, and after downloading the Unacademy app, there the link of the session will be provided. Also in the message session I will give you the link, and there if you want just finishing after the YouTube session, you will get the link of the session, and you can have a conversation with me of about 15 minutes. So let's start with the session. So today's session is about the basics of anatomy. So I will start with what is anatomy, okay, why we are going to study human anatomy, and what is the importance. Okay, so when I am talking about human anatomy, exactly it is the science that deals with the structural and morphological arrangement of various components of the body, that is tissue, organs, and the various parts of the body. Now when I am talking about the word anatomy, it is derived from two words. One is anatome, and the other one is ana, that means upon, and tome word means cutting. Actually most of the anatomy words has been derived from Greek or Latin words. So the first thing is very important, that we have to know what is anatomy. So anatomy is a science which deals with the structural and morphological arrangement of various components of various parts or components of organs, structures, tissue in our body. And it is very important to have a detailed knowledge of human anatomy if you are going to get entry in the MBBS course. Now, and this word anatomy, if I talk about the word anatomy, the word anatomy has been derived from two words, that is, one is ana, the word ana means upon, and the word tome means dissection, cutting. So the word tome means cutting, that means dissection. So the most important part how to study anatomy is the process of cadaveric dissection. So actually we are going to have a detailed knowledge of anatomy by various structures studied by cadaveric dissection. So ana means upon and tome means cutting. So this is the whole what is mean by anatomy or anatomy. Learning anatomy is not just memorizing these things, okay. It's not that we will memorize the facts, so we will go for dissection and we will not correlate the structure. So actually it is to be learned by understanding the developmental aspect, the functional aspect, and the clinical aspect. Then only we will have the full command on the subject, that is anatomy. Now, my dear aspirant, it is also important for you to know what are the subdivisions of anatomy. So actually anatomy is itself is having various subjects. So anatomy is one large subject which is subsequently having various subparts. So in anatomy we are going to have a study of gross anatomy, means the structures. Gross anatomy means the structures which can be visible to our eyes. We will go with dissection. We will have the study of gross structures, that is gross anatomy. We will have the study of microscopic anatomy, that means those structures which is basically dealing with the histology study, that means which structures which is not seen by the naked eye but can be seen when it is focused under the microscope. Development anatomy means we will study embryology in this, okay. So how the fetus is formed, how the organs are formed, how the structures are formed, body wall is formed, how is brain, how is heart, kidneys, and every structures are formed. Living anatomy. Now in our body we know that there is pulses. For example, if you want to take the pulse, you want to palpate radial artery. So that would be done only when you are knowing that where is the radial artery located. So living anatomy means those structures can be known exact location on the body, and we will palpate it, and we can have the detailed knowledge of this. So this is also actually, before it was called as just surface anatomy, that is also topographic anatomy, means important nerves and vessels location, palpation is all related to this living anatomy and topographic anatomy. Radiological anatomy means we have to know the normal x-rays. So I am not telling about the abnormal, but normal x-rays of various regions must be known to. Same way, when I am talking about microscopic anatomy, histology or microscopic study of normal structures, you have to know. When you go in second year, you study pathology, in which you will study the abnormal structures, how it look under the microscope. Clinical anatomy, comparative anatomy, and experimental. Actually, comparative anatomy and experimental anatomy is more for research work. So this will be not so. Previously, the comparative anatomy with that of the animals and anatomy was also discussed, but now it is out of the syllabus. Don't worry. Those who are doing some research work in anatomy, they will go with comparative or experimental anatomies. Now, Actually, why I am showing you this study of anatomy, actually a study of anatomy is a pyramidal concept, okay. So always we want to achieve the apex of it. What we want to achieve the apex, that is clinical anatomy. The main goal why I am stressing more on the subject anatomy, that we want to identify the cases. So you want to go for surgeries and all, but my dear aspirant, that is the apex of the knowledge. For that you have to know the base of it. The first foremost structure which you have to know being in the first year MBBS is that you have to know the anatomical terminology. Now, what happens when I was also joined the MBBS for the first time, the first year books and the first general anatomy books, so many terminologies were there and it was all going out of my mind. And same way I can understand few of the students of this channel, that is future doctors Unacademy, have told me to take this osteology part of anatomical terms, which I will take today, and that is necessary to understand the anatomical terminology. That is very much necessary to attach the knowing the first the anatomical terminology. So if it is not finished today also, I will have 2 sessions on this topic. You have to know the knowledge of anatomical variations. 3-dimensional anatomy you have to understand. You have to understand the function of structures. You have to understand the living anatomy. You have to have an idea of radiological imaging and imaging techniques, and then the ultimate goal is achieved, that is clinical anatomy. Now, according to the new curriculum, that is you will have to give the next also, then everywhere you have to know the basic understanding of the subject of anatomy, which will be correlated with the clinical anatomy question. So generally it is very important that you should know the basic of every topic, so your concepts should be clear, so that direct MCQs is not generally asked for your next exam, but it will be more of clinical aspect. So achieving good marks or solving this MCQ requires more of knowledge of understanding the anatomy. So this is how we have to reach the apex of the pyramid, and we are in the baseline now. Okay. Now, let's talk about anatomical terms, which is very important for you to know when we are going to study the osteology part and when I am describing a bone. So, when you are, for example, when you start with the gross anatomy, the first thing which is very, very important for you to know is the osteology part, and you can understand osteology part only when you can understand the anatomical terms which is used in the description of the bone. So, let's start with this. So, various terms are used. One of this term is called as foramen. One of this term is called as foramen. Okay. So, foramen means an opening or a hole in the bone. So, I will be very basic in defining this structure. It means opening or a hole in bone. What does foramen means? Foramen means an opening or a hole in bone. So actually various foraminas are seen in the interior of the skull. So you are seeing this image, let me just highlight this image. So here when you, for example, we will have the study of, so let me just highlight this. So I am just enlarging this, and when I am enlarging this, my dear aspirants, you can see various foraminas are there. Okay, there is one gap here. Okay, this is one gap, there is one gap here, there is one gap here, there is one gap here, there is one. So various smaller foraminas are there. So actually these foraminas location, so the location of this foramina is very important. So why I am using the word foramina? Because there is many foraminas. Okay, so actually if you will see, there is foraminas here also, there is foraminas various location we have got foramina. So in the interior of the skull we have got hole inside in the bone, and an opening or a hole which is residing inside the bone is termed as foraminas. So actually there are various foraminas. There is optic canal, there is supraorbital fissure, foramen rotundum, ovale, spinosum, jugular foramen. So don't worry, there is multiple of the names of the foraminas residing inside the cranial cavity. So as we are in the basic class, I am not going to describe each foraminas now. I am going to describe today the terms and the difference between the osteological terms which is used for understanding the bone. Is it okay? So any of the students, if you are not understanding anything, please let me know. Okay. Now, let's talk about another word, that is canal. So when I use the word canal, when I am using the word canal in respect to the bone, what does that mean? Okay. So canal means a bony tunnel, means foramen of some length. In simple terms, if I want to explain you, it means canal means foramen means an opening, but foramen is of some length, So it's like slightly, looks like a tunnel. So see here. So I have included a bone that this bone is a sphenoid bone. Okay, the name of this bone is sphenoid bone. The shape of this bone is butterfly like. It is looking like a butterfly. Okay, so sphenoid bone, how it looks? It looks like a butterfly. So you can remember like this, that it looks like a butterfly. Okay, so it looks like a butterfly as you can see in this diagram. Okay, just a minute. So as you can see in this diagram, it exactly looks like a butterfly. So yes. So it exactly looks like a butterfly as seen in this diagram. And if you will concentrate in this image, what you can appreciate when, for example, if I am just enlarging this, I am enlarging this diagram. So you can see a canal. Can you see the greater petrosal nerve is passing into a canal, and this canal is also called as canal for widened nerve. So this is called as pterygoid canal. What is the name given to it? It is called as pterygoid canal. So pterygoid canal, you can clearly see that this red color structures which is traversing here in this space, this here you can see just above it is the opening of pterygoid canal. Okay, so so that is important for you to know that this opening which you are seeing is just an opening, but exactly it will be traversing in the form of a canal. So that is called as pterygoid canal. So in this diagram you are just seeing the opening of pterygoid canal. It is a longer, you can say in simple language, it is a some distance or long length of a foramen is called as canal in terms of osteology. Okay, now let's move on with other word, Canaliculus. Okay, Canaliculus. What does we mean in Canaliculus? So let me explain this. So when I am using the word Canaliculus, the word Canaliculus means a very, very narrow canal. Narrow, very narrow canal. Okay. So just I have used a term canal, and this word is Canaliculus. So when I am using the word Canaliculus, it means a very narrow canal. So actually in this here I just want you to show this bone. This is actually temporal bone. Which bone is this? This bone is temporal bone. This is temporal bone which is lying on the lateral aspect of the of our skull. And when I am enlarging it, see here. So when I am enlarging this temporal bone, what you can appreciate here, there is a Canaliculus cochleus, there is Canaliculus mastoidus, okay, there is Canalis facialis. So there is a minute Canaliculus tympanicus. Can you see here? This is a minute, this is minute Canaliculus, this is minute Canaliculus, and this is also the aperture of minute Canaliculus. So that means it's a very, very narrow canal inside. Actually at times when you see the bone, it becomes very difficult for you to appreciate it. So see here, that is the opening. This is a temporal bone, and what you are seeing is the opening of these Canaliculus, and that is very, very, so in general term you just understand that they are very narrow canals are called as Canaliculus. Okay, now the next is Meatus. So again you are seeing a temporal bone, and the word Meatus means a narrow passage. It means narrow passage. These all things are also written in your book, but images is not there, so you are not understanding. So let me just highlight this image. Okay, so when I am highlighting this image, you can appreciate a narrow passage. You can clearly appreciate narrow passage, and here you can see internal acoustic meatus. So actually in this diagram you are seeing inside, this is the opening, here is the external auditory meatus, but there is a communication inside and it forms inside a passage. So meatus opening, so here internal acoustic meatus, external acoustic meatus. The word meatus means passage. The word meatus means passage. The bone which you are seeing is the temporal bone. So it is present in which bone? It is present in temporal bone. It is present in temporal bone. Now let's talk about sulcus. The next important feature which you want to know is the sulcus. Okay, so let's talk about sulcus. So when we are talking about sulcus, again which bone I have used? The bone which I am showing you is the sphenoid bone. Okay, the bone, it is already written here, is sphenoid bone. And we have to understand what is sulcus. The word sulcus means a groove or a furrow. So it means a groove. In normal terms, you can just, a groove is called as sulcus. Okay, groove is called as sulcus. So here we can see the sulcus is here, or a groove. So here you can see the groove or sulcus are similar things. So when I will enlarge this, you can see the small groove or depression is lying here. This is the groove for optic groove. So this is actually a you can say optic sulcus or a groove which is lying in the body of sphenoid bone. Okay, got it? Body of sphenoid bone. Now next is pit or fovea. So in the bones, we have also used the term pit or fovea. We have used the term pit or fovea. So let's talk about pit or fovea. Now the word pit or fovea means a small depression. So the bone which you are seeing is the femur bone, the longest bone in our body. This is the femur bone, which is the longest bone in our body, and this is the head of femur. When I use the word pit or fovea, it means a small depression. A small depression. It means a small depression. Let me just highlight this image. So I am enlarging this image. When I am enlarging this image, you can see here there is a depression as shown here, this small depression, and this depression is this small depressed part which you are seeing is on the head of the femur bone. It is located on the head of femur bone. So this is exactly pit or fovea. Let me know, are you understanding? Any doubt, please ask me. Any doubt, please ask me. Okay. Now, I would also like to show you another diagram where you can appreciate pit and fovea, and this pit and fovea, this is another, this is again the femur bone which you are seeing. The head of femur bone is having a small depressed area here, that is called as fovea, capitis femoris, or it is called as pit, or it can be called as a fovea. Both are similar structure. Fovea or pit is a small depression, and here the small depressed structure is seen on the head of femur. Okay, so also we have got another term which is called as foveolae. What is it called as? Foveolae. Okay, the word foveolae. So foveolae means a very minute fovea. Okay, minute. So just now we have talked about pit or fovea. Actually, in that diagram, when we are talking about pit and fovea, here you can see here, when I am talking about the word pit or fovea, it is very easy to appreciate the depressed area here, pit or fovea. Here also we can appreciate this pit or fovea. But when this pit or fovea is very minute, it is called as foveolae. So write on. A minute fovea or pit is called as foveolae. This is seen in the cranium bone. So let me just highlight this, enlarge this diagram. Here you can see, can you see this small depression, which is like this here, a very small minute depression. These are only present in the interior or the skull cap. What is this part? This is the skull cap, which is also called as calvaria, and here you can see granular foveolae. These are called as granular foveolae. Here we have got foveolae here. So these are few foveolae which is seen in the interior of the skull cap, which is also called as calvaria. Okay. So yes, my dear aspirants, so these were few important, so we have today to cover up all important terminologies, and for the understanding of the osteology part, we have to understand the various terms, because when the person starts to study the initial chapters of the bone or osteology part, they got confused with this fossa. These terms actually बहुत terms होते हैं, fossa होता है, faceit होता है, linea होता है, processes होता है, tubercles होता है, tuberosity होता है, condyles होता है, epicondyles होता है, Malleolus होता है. So many foramens होता है, canals होते हैं. So many of these terms are used, and basically at times you get very confused by seeing this structure. So I will just clear the doubt by these images. Okay, now the next term which is used is fossa. Now, when I am using the word fossa, it means a large depression. Actually, sometimes the fossa can be articular also, or sometimes it can be non-articular also. So, here again I am showing you the temporal bone, and actually what I told you, temporal bone is lying, it is surrounding ear, close to here. Here we have got the temporal bone, and in this temporal bone there is a fossa. The term is called as mandibular fossa, which will articulate with the mandible bone to form TM joint. Okay. So, let me enlarge this. The term fossa means a large depression, which may be articular or non-articular, which can be articular or can be at times non-articular also. Now, here you can see this structure which you are seeing, is the fossa, which is called as mandibular fossa. What is it called as? Mandibular fossa, which is going to articulate with the condyles of the mandible to forming TM joint. Okay, TM joint. So, this large depressed area which you are seeing may be articular or non-articular, which is present in the temporal bone, is called as fossa. Okay. So, yes, are you understanding everyone? Let's move on to the next. So, I would also like to show you some one more example I have taken. This is a more large fossa which is forming an hip joint. So, here if I enlarge it, you can see here, this is called as acetabular fossa, as you can see in the hip bone. This is called as acetabular fossa, and the acetabular fossa will be, so here you can see the outline of the acetabular fossa, and this acetabular fossa is articulating with the femoral head, and this will lead to the formation of hip joint, ball and socket type joint or hip joint. So, again this can be articular, and this is a large fossa. This is an example of a large fossa. Now, okay, also I can show you much larger fossa. For example, you can see this is again showing a much larger fossa. It's a large depressed area. So, when you will, let me highlight this image. So, see here, I am showing you the interior of the skull, and when you see interior of the skull, what you can appreciate, that the interior of the skull will have 3 large fossa. So, I am outlining this one. What is this called as? This is called as anterior cranial fossa. So, this is called as anterior cranial fossa. This whole area which I have shown you is anterior cranial fossa. This is the very large fossa, and it is seen in the interior, as you can see. And next is, just see the next one. The next to it we have got the middle cranial fossa. So, this is the middle cranial fossa which you are seeing. This is the middle cranial fossa which you are seeing. Okay, this is the whole outline for the middle cranial fossa. Okay. This is more deeper than this is anterior cranial fossa, this is middle cranial fossa, and this will be the posterior cranial fossa. This is middle, and this will be the posterior cranial fossa. Now, see here, this one is the middle cranial fossa, and in this category the deepest fossa which you are seeing will be the posterior cranial fossa, this large depressed area inside. So, this hole will be the posterior cranial fossa. So, is it okay? Have you understood the difference between whole part? So, these are large depressed area or large fossas as shown in this diagram. Okay, let's move on to the next one, that is faceit. The next is faceit. Faceit, when I use the term faceit in case of osteology part, it's a small, smooth, flat, articular surface of the bone. Okay, so actually when you will see the vertebrae, we know that in our body at the back we have got vertebral column which is made of cervical vertebra, thoracic vertebrae, we have got lumbar and sacral vertebrae. In that vertebral column, the articulation is there between superior and inferior facet of the consecutive vertebrae, and these are small, smooth, flat, articular area of the bone. So, what is facet? Facet is small, smooth, flat, articular area of bone. area of bone. Okay, now see areas of the bone. So if for example here you can see this is the superior articular facet. If you want I can slightly enlarge it. This is the superior articular facet, and here you can see this is the articular facet for the sacrum lower down, and this is again you can see this is superior articular facet. So actually these facets, so there will be one superior and there will be one inferior. So that smooth articular surface between the will articulate here. Superior articular facet will articulate with the inferior articular facet of the consecutive vertebrae. Now the next term is insisuras. Insisura. What do you mean by insisura? Insisura. Okay, actually the term insisura means notch. The term insisura means notch in terms of bones. Notch, it means notch or a cut in the margin of the bone. To be more specific, it means notch or cut in the margins of bone. Okay, now let me just show you this diagram. Actually this is the frontal bone which you are seeing, and here when I enlarge it you can see here lower down there is notch here. There is a notch at the superior margin here. It will be around just above the eyeballs, and here in this just lower part of this frontal bone here there will be notch. So here is one notch. This notch is called insisura supraorbitalis. There is also one notch more towards the medial aspect. This is called insisura frontalis. So here you can see the notch. These are small notches which is seen at the border of the bone. Here you can see which bone? This is the frontal bone. This is the frontal bone of the skull. So this bone, this part, this is the frontal bone, and below here there will be two notches. One is supraorbital notch, another is the frontalis notch. That is a cut in the margins of the bone. Now let's move on to the next term. The next term is linea. So the word linea. Okay, so when I use the term linea in case of bone, it means an elongated elevation of line. What does the term linea means? It means an elongated elevation or a line, and basically we have seen a linea aspera in case of longest bone in our body, that is femur. Elongated elevation or line is called as linea, and this we appreciate in case of a elongated longest bone in our body, that is femur. So let me just enlarge this. Okay, so here you can see this is the shaft, this is the femur bone, and this is the shaft of the femur bone. This is the shaft of the femur bone. In the shaft of the femur bone, that long elevated line which you are seeing here, this is called as linea aspera. This line is called as linea aspera. Okay, this line is called as linea aspera. If I rub it also, you can appreciate this elevated part. Okay, this elevated line which you are seeing, this whole line is linea aspera. This is present in the longest bone of our body, that is femur. Now, the next important point which you have to understand is ridge. What do you mean by the word ridge? Now, when I am using the word ridge in case of osteology session, it means a linear elevation which is usually rough. Okay, when ridge, okay, when I am using the word ridge, it means a linear elevation, and this is usually not very smooth but rough. So it is linear elevations. Usually rough. So here supraorbital ridge is there. Here where our eyebrows lies, here we have got supraorbital ridge. So this is which ridge? This is supraorbital ridge, which is shown in this diagram. This is the supraorbital ridge. Now, again another diagram I want to show you where you can appreciate. If I enlarge this bone, okay, this is showing the skull lateral view. This is showing the skull lateral view, and here this elevated part which will be lying over the eyebrows, this elevated part is called as supraorbital ridge. This is supraorbital ridge. Okay, and here this part of the bone which you are seeing here is the temporal bone. This is temporal bone. Okay. So I think the by seeing various diagrams, it is quite understand to you. You are understanding the facts of difference between the various terms and terminologies used when we are going to study the osteology part. Okay. Now let's talk about the next. Crest. The next important point is crest. What do you mean by the word crest? So when I am using the word crest, it means a ridge of some breadth. So here it is also a ridge, but the ridge is of some breadth, some width you can say, or some breadth, width. So when you will see the superior border of the hip bone, okay, or innominate bone, can you see here the superior border is in the form of ridge. That ridge is not like a line or linear elevation. It is not very smooth and it is not very thin, but it is width. It is having certain width, so it is called as iliac crest. The example of crest is present in hip bone, that is iliac crest. This is present in hip bone, which is also called as innominate bone. Okay, let's talk about the other term, lip. So when we see the osteology part, the term lateral lip, medial lip, it is used. One of the best example of lip is, lip means raised margin of a crest. So the better definition will be, it is a raised margin of a crest. And I would like to show you a diagram here. Let me just enlarge it. Okay, so here for example, this is the humerus bone which you are seeing. This is a humerus bone which you are seeing here, and in the humerus bone, what you can appreciate, there is elevation here. This is the lesser tubercle and this is the greater tubercle elevation. So these are greater tubercle and lesser tubercle elevation, and lower to it there is a bicipital groove. Okay, Priyanshu, okay, okay, this is for you only, Priyanshu, okay. And after this, when I will complete this session, I will also have interaction with you. I will speak on phone and you can hear me. I will tell you all important points, how to start the study of anatomy. So every day we will have, whenever I will take a YouTube session, it will be followed by 15 minutes of discussion, which you can attend it. When you can attend it in the Unacademy app, there you will get the link of that open house session. Okay, that will start just when I will finish the YouTube session. So here you can see this is a depressed area. So this is bicipital groove. Actually this part will be the bicipital groove. This is a depressed area, so this is groove, but surrounding to it there is a small ridge here and there is a small ridge here. So these are in the form of ridge. So surrounding to it we will have a ridge medially and we will have a ridge here. So just surrounding to this groove area we will have ridges. Okay, so these are actually called as the ridges. There will be ridges surrounding this groove, and a very important example, lips. So this is in the form of a raised area which is called as lip. To be more specific, it is called as lip, medial or lateral lip. So the basic term will be used, lips, and that is medial and lateral lip of bicipital groove. Bicipital groove. Okay. Okay, so yes, I think, so let's move on to the next. The other thing which is seen commonly here, okay, so processes. Okay, so yes, when I talk about the processes, so the word processes means means a localized elevation or projection of large size. Localized elevation or projection of large size. Okay, processes. So see here in this diagram I am showing you the okay, Priyanshu, just see here, this is the lateral view of the skull. So when I am enlarging this diagram, again what you can see, can you appreciate this process? This is mastoid process. So this is again the part of which bone? This is again the part of temporal bone, and this is the process which is called as mastoid process. So we can define processes as, the definition of processes will be localized elevation or projection of large size. It means localized elevation or projections from the projection of large size generally from the part of the bone. Okay, the next important thing is to understand tubercle. What do you mean by a tubercle? The word tubercle means small localized rounded thickening. The word tubercle means small localized rounded thickening. Okay, rounded thickening. So see here, if I enlarge this diagram, again if I enlarge this diagram, you can see there is greater tubercle GT, this is greater tubercle, and this is lesser tubercle LT. So this elevations which you are seeing, this is a rounded, this tubercle is a localized rounded thickening which is seen in the case of this humerus bone. So these are the case which is seen in the humerus bone. We have got greater and lesser tubercle in case of humerus bone, which is a small localized rounded thickening. Now, the other term which is also at times the students get confused is tuberosity. They will tell what is the difference between tuberosity and tubercle. Actually, tuberosity is similar to tubercle, but generally comparatively the size of tuberosity is more than the tubercle. So see here, I am taking an example of tibia. This is a tibia bone, and at the anterior of the tibia bone, this elevation which you are seeing, anterior aspect, this is called as tuberosity. So in general, when you will see the size of, when you appreciate the size of tuberosity, the size of tuberosity is generally more than that of tubercle. So it is just a tubercle, but the size of this. So this is a diagram where you can see tibia bone where anteriorly lies the tuberosity. So just write it. Tuberosity means it is same as tubercle, but large in size, Okay, but large in size. Now, see here. Next, we are talking about head. Okay, head is most easy to understand, Priyanshu, most easy to understand the head. When I am talking about the word head, it means a small rounded articular surface of the bone. So, yes, most important example which you can see here is the head of the femur, here head of the femur. So, head is a rounded articular surface of the bone. Head is a round articular area of bone. Okay, the term which is generally seen in the bone or osteology part is condyles. So, condyles means small rounded articular surface or ends. So, generally condyles are at the ends of the bone. So, condyle is small rounded, they are small rounded articular surfaces seen at the end of the bone, surfaces at the end of bone. So, here you can see this is a medial condyles and this is the lateral condyle of femur which is articulating with lower down the tibia. So, this is lying at the, so these are rounded projection. Okay. So, these are small rounded articular surface at the ends of the bones. I have shown you the fossa and notch, I think. Let me come again with that diagram. So, I think I have done with the earlier only fossa and notch. See here, if I talk about fossa, these are large fossas. Can you see here? This is anterior cranial fossa, middle cranial fossa. So, this is inside the cranial cavity. These are large fossas. Here you can see in the case of hip bone also, this is acetabular fossa. These are large depressed area. Okay, this is mandibular fossa in the temporal bone which is taking part in formation of TM joint. So, they are large depressed. They are large depression. Okay, they are large depressions are called as fossa. Okay, and notch means, notch for example, if I talk about supraorbital margins, notch. Okay, notch, I will, supraorbital margin is having a notch. I'm coming to that diagram. So, see here, insisura or notch is similar thing. Can you see? So, a bone is there and there is a notch. A bone is there and there is a gap. So, notch means a gap. Notch means a gap. Okay, what is the difference? Fossa means a depressed area. For example, cranial fossas are there, but notch means a gap, small gap. Notch means a small gap in the bone. For example, यहाँ पे word insisura है, that is also corresponding to notch in the margins. So, this is eyebrow, which is the supraorbital margin. Here we have got notch. Inside there will be a notch. That is called a supraorbital notch. See here, insisura word is called as notch. What is the other, Priyanshu? Insisura word means notch, means a gap. A gap in the bone is notch and a depressed area is called as fossa. Is it okay, Priyanshu? Okay, let's move further. Okay, now the next term which I want to explain you is epicondyle, epicondyles, okay, epicondyles. So the next term which I want to explain, is it okay? Epicondyles, okay. When I am using the term epicondyles, okay, epicondyles means non-articular bony projections, situated above the condyles. So if you will see, this is the condyles, okay. So you can see just above the condyles. So medial epicondyle is there and this is lateral epicondyle. So this is a small projections, okay. So this is the bone, this is the humerus bone, and epicondyle means non-articular. They are non-articular. If you see they are non-articular projections, situated above condyles, or articular part, above condyles. So for example, in case of humerus bone, we have got articular part at like capitulum, just above a small bony projections are there. These two bony projections are called as epicondyles or lateral epicondyles or medial epicondyle. Now, trochlea, the word trochlea, when we are using the term trochlea, it means it is pulley shaped. The word trochlea means pulley shape. Pulley shape articular area. So see here we have got the trochlea and the outline of trochlea is pulley shaped. So this is trochlea which is lying in the lower end of the humerus bone, and this is exactly pulley shaped, so it is called as trochlea. Trochanter. Now the next term is trochanter, large non-articular projection. So large, so see here, this is greater trochanter or in the femur, this is the lesser trochanter. So these are projections. Can you see here, two projections are there, one superiorly and one inferiorly. So they are not smaller projections, they are large projections in the bone, large projections. So large non-articular projections of bone, are called as trochanter. We have got trochanter in which bone? We have got trochanter in the femur bone upper end. We have got trochanters in the femur bone upper end. Now, Malleolus. The term Malleolus. Actually, malleolar word means hammer like, hammer shape. You can say it's a hammer shaped bony projections. It is hammer shaped bony prominence. You can say bony prominence. So if you will see this diagram, let me just enlarge. Actually, the lower end of tibia and fibula. This is the lower end of tibia and this is the lower end of fibula. Okay. So you can see these are having prominences, projections, okay, in the form of hammer type. So this is medial malleolus and this is lateral malleolus. So in case of lower end of fibula and the lower end of tibia is called as malleolus. These are called as malleolus. Now spine. The word spine means a sharp pointed bony projection. The word spine means sharp bony projection. Okay, sharp bony projection. Actually, you are seeing inferior of the skull, and here you can see a small bony Can you appreciate this number 2? What is this number 2? This is a bony projection. Actually, this is a spine. This is the spine of sphenoid bone. This is the spine of which bone? Sphenoid bone. So this is the inferior view of the skull where you are seeing a very sharp projection. This sharp pointed part is called as spine. Okay, this sharp pointed part is called as spine, which is seen in the inferior aspect of the skull bone, spine of the sphenoid bone. Now, Hamulus, the word Hamulus. So let's talk about Hamulus. So actually the word Hamulus means hook-like. What does it mean? Hook-like. So a hook-like projection. So hook-like, the word Hamulus means hook-like. That means a hook-like projection is called as Hamulus, and here you can see the hook-like projection is there in the sphenoid bone both medially and laterally. So yes, basically Hamulus you can see here. So this hook-like projection which you are seeing here. So if we talk about this, only this part, that is a projected part, that is called as Hamulus. So here you can clearly see a hook-like projection, that is called as Hamulus, and again you are seeing butterfly-shaped bone, that is sphenoid bone. Okay, now uncus. A term uncus is also used in terms of the bone. The word uncus means small hook. The word uncus means small broad hook. Broad hook. So see here you can see slightly small enlarged hook, you can say simply. So you can see uncus here, uncinate. So you can see here this projection which you are seeing here on both the side, there is a projection area that is called as uncus. This is small broad hook, small elongated broad hook, you can say. Small hook, you can see in other terms small elongated hook. The term which will be used is small elongated hook. So I think the diagrams are making you understand, Priyansu. Okay. Now the word Karuna. The word Karuna. So the word Karuna means horn-like. Horn-like. So projection in the bones which is horn-like is called Karuna. So I have taken an example of hyoid bone. So you can see here in this diagram, this is a hyoid bone. So this is a hyoid bone. This small bone is lying in the anterior part of the neck, and this is lying above the thyroid cartilage. Above the thyroid cartilage we have got hyoid bone. This is the enlarged view of hyoid bone, and you can see it is having greater and lesser Karuna. So what is this Karuna like? This Karuna is horn-like. So what is this greater horn or lesser horn is also used the term Karuna. It is also called as Karuna. These are called as Karunae. Got it? Now, Lingula. The next is Lingula. So when we are using the term Lingula, what does that mean? When we are using the term Lingula, it means tongue shape bony projection. Small tongue shape bony projections. Bony projections. So yes, actually this diagram, if you will see, can you appreciate this projection? This is a tongue shape, this is Lingula, this is tongue shape bony projection. This is tongue shape bony projection which is seen in the interior of the mandible, which is appreciable in the interior of mandible. Now I will again show you this diagram. Okay. So yes, so here you can see when I enlarge this is again the Lingula, as you can see, this tongue-like projections which is covering the mandibular foramen, which is covering the opening of mandibular foramen. So this is called as Lingula. Now coming to ala. Ala means wing or expanded part. Ala means expanded part. The word ala means expanded part. So when you see the bone sacrum, on either side you can see the sacrum is having an expanded winged part. It is wing-like or expanded part. So this whole area of the sacrum which is winged or expanded in nature, expanded part is called as ala of sacrum. What is it called as? It is called as ala of sacrum. Got it? Now we are talking about pterygoid. Now the next is pterygoid. When we are talking about pterygoid, okay, so the word pterygoid, when we are talking about pterygoid, the word pterygoid mean, okay, the word pterygoid is also somewhat winged projection. It is also winged projection but not a very large wing. With this pterygoid means small wing. Pterygoid means small winged projection. So here this projection which you are seeing, is winged but it is not very large. This is called pterygoid process as seen in the sphenoid bone. As seen in which bone? Sphenoid bone. So those who are just entered in the first year, please don't get confused with this bone name. Subsequently you will understand. I am just showing you, concentrate on the name or projections or different elevations termed which is used. That is only the point to understand. Later with consecutive class you will understand each type of bone and each bony parts. Okay. Lamella. The word lamella. So when we are using the word lamella, so here you can see lamella. So lamella, the word lamella means thin plate of bone. Thin plate of bone. The word lamellae means thin plate of the bone. So here actually you can see this plate-like projection, this is plate-like part of the bone. Can you see? In the case of vertebra, we have got a part which is connecting the body and the processes of it. So actually this is called as the body of vertebra, and these are the processes. We have got mammillary, transverse, spinous process, and the part which is connecting it is a thin plate of bone, and this thin plate of bone is called as lamella, which is present in the vertebra, lamella. Squama. Squama. Actually the word squama means when a part of bone will look like a scale when it is growing. When a part of bone, when it is growing, it in the growing period it was looking like a scale. So for example, here the example of parietal bone is taken in the frontal, parietal and all. So what you can see, this bone part, you can see it is having the growth like a scale. So it is scaly in appearance. So this part of the bone is called as squama. And here also, if you will see, in the case of temporal bone, also we have got the squamous spot. Here the whole part of it is having the shape which is like a scale. So it is growing like in various periphery direction, scaly. So that whole appearance is called squama. So the word squama means part of bone, bone looks like scale, bone is like a scale, bone looks like scales. Now, the term sinus. So, the next term which you have to know is sinus. So, when we use the term sinus, so the word sinus is used when exactly in some bones. For example, if I enlarge this diagram, what you can see, this is the maxillary bone which is containing a cavity inside. So, the word sinus means cavity. The word sinus means a cavity. So, when a bone is having cavity inside, it is called as sinus. So, a hollow cavity. So, what do you mean by the word sinus? Means sinus. The word sinus means hollow cavity, and in some of the bones cavity, hollow cavity inside, and in some of the bones like maxillary bone, sphenoid bone, okay, ethmoid bone, we have got sinuses inside. Okay, so these are sinuses, or air filled space is lying inside, which is making this bone lighter, and generally the facial bones will have air inside, so that it is making the whole head weight lighter. Okay. So this is air spaces, that means it is having air spaces trapped inside, air spaces which is trapped inside. So my dear aspirants, we will I will end, and before ending I just want you to give an information. Like one of the session today I have taken anatomy quiz at 6 p.m. session, and it ended at 7 p.m. and 7:05 I have taken strategies to crack the exam for open house. Now I am going to complete the conceptual understanding of anatomical terms part 1, and then again open house session will start in another 5 minutes. So I will end this session, and another 5 minutes the open house session will start, where you can hear my voice on the phone. You must be having Unacademy app on your mobile. So there you can just connect to hear my voice, and I will help you and guide you that these terms are why very important for you to study, and how stepwise we are going to complete the important topics of anatomy, and how you are going to crack your exam with a better numbers and better point of view for cracking your exam with a better and flying colors. And these are whole things. So you will get a link provided. Okay, so in this also a message I can give on Unacademy app. Also there will be a link, so via that link you can just get connected to it. Okay, so and also if you open Unacademy app, you will get the link of my session, that is open house discussion session at 9:05. Why I have kept the timing 9:05? Because I will complete the session by 9, and in another 2-3 minutes you can get connected to me. The students joining the session of free class for the first time, they can use my code ANAT10 and be present for live session. I want you to give information regarding okay, yes, so I want you to give information regarding All India mock test which is going to happen on 19th Feb 9 AM. Use the code ANAT10, and get enroll for the test. Okay, you can get enroll for the test by using the code ANAT10. All India mock test it is on free platform, so just grab this opportunity, And my dear aspirants, before ending the session, a comparative pricing detail of the Plus and the Iconic has been shown. So this will help you to know which subscription you have to take. This will be highly beneficial for you. You can use my code ANAT10 and you can get 10% discount, and this will be highly beneficial. And before ending, I want you to tell that do present for all the sessions. It is very important for you. Do like, subscribe the channel, that is Unacademy Future Doctors. And if you are attending the session on the special platform of Unacademy, you can download the PDF notes also. And if you are going to take the subscription or unlock code, you can use the code ANAT10 for taking the subscription and 10% discount. So just go for it. All the best. Keep studying. So all those who are present live, they can join me for open house session, which I am starting in another 5 minutes. All the best. Keep studying, my dear aspirants. So I am just starting open house session in another 5 minutes. Thank you. Thank you, my dear aspirants. Okay. So open house session at 9:05 p.m. You can join. Okay, you can join that. All the best. Keep studying. Thank you so much.